Okay, so welcome again to our webinar this evening, Diabetes During Ramadan. We're joined today by two very special guests, Dr. Tahseen Chowdhury, who's a consultant in diabetes at the Royal London Hospital with a special interest in diabetes in South Asians and diabetes and renal disease. And he's also been involved in research around diabetes in Ramadan. And our second panel member is Sheikh Mahmoud, who is the senior Imam at the East London Mosque and the London Muslim Centre, sorry. And we'd like to thank them both for joining us. And we'd just like to start the presentation by handing over to Sheikh Mohammed, who's going to start with our two talks. Thank you.
Thank you, Anthony, and good afternoon, everyone. And thank you for the warm invitation to this important webinar on diabetes, diabetes and Ramadan, or diabetes in Ramadan. Now, I'm no specialist on diabetes, but I am a specialist on Ramadan, I could say. So really, I'll keep it quite brief. As Muslims believe, God does not task a soul more than it can bear, more than it can take. So he prescribed the worship, the acts of worship and the obligations which he prescribed. Every soul and every person can withstand these obligations and can perform them. And that is because God created us. He knows our nature. He knows what is good for us and he knows what is bad for us. And he knows what's in our interest. And he knows what suits the majority of mankind, by and large. So all of the, if you like, the pillars of Islam, or the obligations such as 5 prayers a day and fasting during the month of Ramadan, and the zakah, which is the alms on savings, which a year has passed on and they've reached a certain threshold, and performing pilgrimage once in a person's lifetime. These are things that are within the capabilities of most human beings. Now, Islam does not overburden its adherents with things that they cannot achieve, and therefore there are always exceptions. Although we believe wholeheartedly that God does not task a soul with more than it can bear and with more than it can cope, some souls and some individuals have extenuating circumstances, and because of that, in Islam there are licenses, what are known as licenses, for and concessions where people can perform the act of worship within their capacity. So, for example, prayer, the 5 obligatory prayers performed during the night and the day that are obligatory for Muslims to perform, they are to be performed standing, as well as the bowing and the prostration within each unit. The unit of prayer starts with the recitation of Quran while the person is standing. But the Prophet, peace be upon him, he told the one who was unable to stand, he said, if you are unable to stand, then sit. And therefore, the person must perform the prayer within their means and within their ability. If they are able to stand, then they stand. If they are unable to stand and can sit, then they sit. If they're unable to sit and must recline, then they're able to perform the prayer while they're reclining. If they can raise their hands and lower their heads, then they should do so. If they cannot, then they can pray with their eyes. And if they can't pray with their eyes, then they pray with their heart, meaning that they observe an intention and visualize themselves praying, and that suffices. Now, that's because prayer is an obligation which apart from certain situations such as menstruation or postnatal bleeding, is obligatory for every adult male and adult female. I think there's a mic on somewhere. Yes, so it's obligatory for every adult male and adult female. Fasting, on the other hand, is obligatory if you are able to perform. If you are able to perform it. Now, there are extenuating circumstances that allow a person, or grant a person the license to break their fast or to not observe the fast from dawn to start with. Some of these circumstances are temporary, and some of them are long-term, and some of them are permanent. So the temporary circumstances are a temporary and fleeting illness and travel. That means that a person who is traveling, or a person who is ill, and there is no minimum threshold of illness. Illness is just stated and is open and general, meaning that if a person has even a mild illness, it's still a license for them. It grants them the license to not fast. But that is the illness that's not long term, that a person can recover from, and recovery is something that is expected. The flu, or they're undergoing some temporary treatment. There is a course of treatment that will where there is an end in sight. And then there are long-term conditions. Now, the long-term conditions, sorry, if I can just rewind, the temporary circumstances, such as a temporary illness and travel, the days that are missed during the month of Ramadan are to be made once that person's circumstances return to normality. So the person returns to his place of residence and is no longer a traveler, and the person returns to a good state of health, which allows them and permits them to fast, and their bodies are able to withstand the fast without there being any threat of the condition which prevented them the first time from returning again. Now, long-term conditions are those where a person doesn't know whether they might come out of those circumstances, and that is illness, long-term illness. Now, long-term illness and a chronic illness, a permanent illness, for these two, and of course there are many medical conditions. Fasting is not obligatory on that person, but there is an alternative. The alternative is, for every day that they are unable to fast, that they feed a needy person a substantial meal. We've all got to learn what a substantial meal is over the last year, because pubs and bars were requested to provide substantial meals. So we know that a substantial meal is not a packet of crisps. So the person who is suffering from a long-term condition, diabetes being one of them, need not fast during the month of Ramadan. Now, of course, not everyone is the same when it comes to diabetes. So some people are able to observe the fast, not least when the day is short and it's not hot. So they're not sweating and they're not exerting much effort. So there is no danger to them. Whereas others are unable to fast at all and must always have within their reach a sugary drink or something to raise their blood sugar level. So such people can pay to feed a needy person a substantial meal, which is approximately £5, as it's a kind of rough figure, really. If a person wishes to increase, then that's better, but not to go lower than £5. Now, of course, this introduction that I'm giving is not a lesson on Islamic jurisprudence, but an exposition on the licenses and the flexibility present within Islam. Islam is not a religion of rigidity. It's not a religion of blacks and whites. It is a religion where nuance is respected, and people's circumstances and their unique experiences are always taken into consideration. And of course, after Professor Chowdhury's presentation, I think there will be a Q&A section where I'll be happy to take your questions. Thank you very much for your attentiveness and your patience with me, and I'll hand back over to Anthony.
Thank you very much, Sheikh Mohammed. And now I'll hand over to Professor Chowdhury, who will give his talk. Thank you.
Okay, Anthony, can you just clarify, can you see the slides? Can you hear me? And can you see my slideshow? Yeah. So you can see it, you can hear me, everything's okay.
Sorry, I was on mute. Yeah, we can see you and see the slides. Thanks.
Thank you so much. Okay, ladies and gentlemen, I'm really delighted. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much for inviting me. My name is Tahseen Chowdhury. I'm a diabetes consultant. I work at the Royal London Hospital just across the way from East London Mosque, and I'm really delighted and honoured to be invited by Diabetes UK and to be speaking with Imam regarding this.
Sorry, Taz, can we just ask that everyone can turn off their mic just to avoid any background distractions during the presentations? Thanks. We'll have a question and answer afterwards if you've got any questions. Sorry about that, Taz.
No problem. So what I thought I'd do, I've sort of 20 minutes, Anthony, to talk to you. And I apologise. I know that many of you know all about diabetes, but I'm just going to give you a little bit of a reminder because I think it's useful just to remind ourselves about diabetes and what it is and what causes it and so on. And then how do we actually manage diabetes during the holy month of Ramadan? And I'm really pleased to see that there are many non-Muslims on the webinar today as well. So I'll try and explain a little bit more about what Ramadan entails as well. So thank you so much for coming. It's great that you're all here. So we have, yeah, I mean, you're all familiar with the word pandemic now, of course, when we talk about a pandemic of COVID-19, and all of you have been struggling through this time. I know many of you have been locked indoors, not able to get out and about. But we've for many years actually had a pandemic of diabetes going on. So in the UK, we've got this huge growth in the number of people with diabetes going on the last 2 decades. So in 2000, we had about 2 million people with diabetes. We're now at 4 million. We're going to be at 5.5 million by the middle of this decade. So the numbers are really growing and growing, as you can imagine. It's predominantly type 2 diabetes that we're seeing. And I think that it's just also useful for us to remind ourselves what diabetes means and what it actually does. So those of you that are aware of anatomy, you might be familiar with the pancreas. It's the most important organ in the body because this is the organ that I deal with amongst all of my patients. And the pancreas is a sort of leaf-like organ in the abdomen. It sits in the middle of the abdomen, quite far back in the abdomen, so you can't really press on it when you're pressing your tummy. But what it does is helps us do a number of things. It helps us digest food, so it produces digestive enzymes, helps us digest food, but it also produces some really, really important hormones, and these hormones are called insulin and glucagon, and insulin is the one that's probably the most important. I'm sorry about this slide. It's a little bit tricky to understand, but just imagine that this is a person that is eating an apple. Hopefully they won't have had a full apple, but you can see this apple is being broken down in their stomach, and it's breaking down into glucose. So an apple contains a fair amount of glucose that's broken down, and that is gradually absorbed into the bloodstream. Now, the pancreas produces insulin, which is absorbed into the bloodstream, and insulin is an incredibly important hormone because what it does is it allows glucose to be uptaken in your body. So, and glucose, as I'm sure you're aware, is like if we think of ourselves as cars, the petrol in the car is our glucose. Okay, so glucose is the thing that really will help us move and give us the energy to live and do the things that we need to do. So, what does insulin do for that? Well, insulin is sort of like the key to the door. I think it's quite a useful way of understanding that actually insulin works by opening the blood cell, or sorry, opening any body cell to allow glucose to enter it. Okay, so if you don't have enough keys, that may be a problem. So if there's not enough insulin around, or if those keys don't work properly, and that's another issue that we see in people with type 2 diabetes, then there's an issue. So two problems in diabetes: not enough insulin produced, perhaps, or the insulin doesn't work properly, and we call that insulin resistance. Okay, so that may be the key not working properly, or there's not enough keys around. And of course, this leads to a big problem, because what happens is the glucose gets stuck in your blood. It can't go into your blood cells. And as a result, what happens is that you can't use that glucose for energy. And that will lead to lots of symptoms. So many of you are familiar with the symptoms of high blood glucoses. So passing lots of urine, drinking lots, losing weight, feeling very tired and fatigued. But more importantly, perhaps, actually, that high level of glucose can, in the longer term, do a lot of damage to various parts of your body. So in particular, your heart, your kidneys, your eyes, your feet, all sorts of areas of the body can be affected by high blood glucose levels. So if you've been diagnosed with diabetes, what should you do? Well, the major things that we always suggest that you do with diabetes is attend diabetes education. And in Tower Hamlets, we run diabetes education in various languages. We run our local communities. There's many people with type 2 diabetes from the Bangladeshi community, so we run them in Bengali, we run them in English, and a variety of other educational languages as well. And recently we've been doing them actually online, so we've actually had really good participation from patients coming online with us in teams. Obviously we can't have big classrooms full of people now, so we've been doing them online. So education about your diabetes, to learn about what it does to you and how to manage it. Focus on lifestyle, exercise and diet. I'll talk about that in a moment. But improve other things like blood pressure. We know that blood pressure, we know that cholesterol, we know that high glucose levels, all of those will lead to an increased risk of those complications that I mentioned. So if we can get all of those well controlled, your blood pressure, your cholesterol and your glucose, then that reduces the risk of those complications. And the other important thing is having regular checks. And that's really a big issue during the COVID-19 pandemic, because of course, many of you are stuck at home, many GP surgeries closed. So actually getting these regular checks is quite a challenge at the moment, and as things open up, and as your GP surgeries are opening up, and so on, very important to make sure that you have your regular checks. When I talk about exercise, I don't mean this. This is the sort of exercise that really doesn't help your diabetes. So walking the dog in a car doesn't really help. But you know, the sort of things that might help. Well, just walking, and of course, you know, during lockdown, it's been terribly difficult for people with diabetes to go out and about. But you know, we should be trying to exercise at least once a day and trying to keep ourselves active and fit. We've got to stop smoking. Diabetes plus smoking, 1 = 5 is what we say. So if you're a smoker and you have diabetes, well, 1 cigarette equals 5 in a person with diabetes. So please stop smoking. Very important. Diet, we've got to do something about the sort of fatty diets, high carbohydrate diets. Reducing sort of salt and sugar and carbohydrates in our diets really has a big impact. So learning about diet is very important, and moving our diet to, I mean, this is a photograph on Whitechapel Road. We have wonderful markets, obviously not very many of them open at the moment, but wonderful markets, fresh food and vegetables. Those should be forming the basis of our diet and lifestyle. And the other important thing, as I've mentioned, is having checks. So you need to have your blood tests checked for your kidneys. You need to have them checked for cholesterol, for diabetes. You need to have your foot checked. You need to have your eyes checked regularly. And as soon as things open up, please insist to your doctor that you have these tests done again. Now, what about diabetes and fasting? Well, Imam Sahib has already told us about fasting. Fasting, we as Muslims believe fasting is a rahmah, a mercy to us. It's something that we want to do. We've been brought up to do. We want to do throughout our lives, and we know that there's huge benefits for us. So in Surah Baqarah, Ayat 183, "O you who believe, fasting has been prescribed to you as it was prescribed to others before you, so that you may attain taqwa," which is God consciousness. So it's really important for us spiritually to fast, and it helps us reconnect with our religion and our Lord. But in people with diabetes, it may be quite challenging. There may be some areas that might be challenging. Fasting in people with diabetes might put you at risk of a low blood glucose level, perhaps even a high blood glucose level if you've maybe not taken enough treatment or had too much to eat. Or the other very important thing is risk of dehydration, which is loss of water. And that's significant risk in people with diabetes, particularly if you have significant heart problems or kidney problems. That can really have a big adverse effect on your health. Dehydration can be very, very dangerous. So what sort of things should we look out for? Well, hypoglycemia. Well, those of you that have diabetes on the webinar today might be aware of the sort of symptoms you might get of sweatiness, shakiness, irritability, dizziness, feeling severe hunger. And as soon as we get those symptoms, we should be thinking about treating that straight away with something sugary, something to elevate the blood glucose. And of course, if this happens during fasting, well, the immediate priority is to stop fasting. You have to stop fasting immediately. There is no ifs or buts about this. This is a dangerous problem, and it has to be your fast has to stop immediately. You need to break your fast, no matter, even if it's just half an hour to go to break your fast. You're going to have to break your fast straight away, because this is a significant danger to your health. Similarly, hyperglycemia, well, this might cause symptoms of feeling very thirsty. You might get abdominal pain, feeling very irritable. You might need to go to the toilet very often to pass urine. These sort of symptoms might indicate that you've got a very high level of glucose, and again, a significant danger to your health. You need to be thinking about testing it and maybe doing something about it, maybe thinking about breaking your fast as well. Other signs of dehydration, well, of course, we all suffer this during Ramadan, particularly in the first week or so. It can be a feeling of a dry mouth, a headache. I get very bad caffeine withdrawal headaches, so I need to reduce my caffeine straight away now. If I can do that now, then that will help me. But dry skin, bad breath, dizziness, fuzzy thinking, all of these sort of symptoms might be symptoms of dehydration as well. So I've mentioned to you the benefits of fasting, but of course, as Imam Sahib has already said, that Allah Ta'ala has given us a wonderful escape clause. He's said very clearly, whoever among you is sick or on a journey, then he shall fast a like number of days, other days, and those who are unable to fast may effect a redemption by feeding a poor man. So offering that alternative will really make your fast valid. It is a form of worship to give charity to the poor. Allah desires ease for you, and he does not desire for you difficulty. And these are just the surahs immediately after the surahs that exhort us to fast. The ayats, I beg your pardon, the ayats immediately after exhorting us to fast, we have an exemption. And for those that are significantly ill or have a significant long-term condition, we have an exemption. So clearly, we should be fasting if we are fit, healthy, mentally competent. We've attained puberty. We should be fasting. Fasting is for us. It's something that is obligatory for us. But there are many exemptions, so where it may adversely affect your physical or mental health. Particularly the elderly, the frail, people who have got lots and lots of other medical problems, pregnancy, breastfeeding, menstruation, mental health problems or incapacity, possibly jobs that require peak physical health, such as surgeons. Many of my colleagues who do surgery during fasting, they don't fast on those days. They fast on other days, and travelers, as Imam Sahib has mentioned as well. So we have exemptions, and these exemptions are important. So you have diabetes, you're thinking of fasting for Ramadan. What should you do? What is the message that I would like to convey to you? Well, I think the main message I would say to you is, please discuss this with your doctor or nurse, ideally right now, ideally even a month or two before Ramadan, to discuss the fact that you're planning to fast, you have diabetes. What do you think? Is it safe for me to do so? If your doctor or nurse advises you that they feel it's very unsafe for you to do so, you should really be heeding that advice. That advice is given to you in good faith. It's given to you for a reason, that they're concerned about your health. And if that is the advice that you're given, then you should really try to heed that advice. and consider other possibilities. Fidya, fasting during winter months, is a valid way of fasting. I have many patients who decide not to fast during the summer. The summer is very, very difficult. Even now in the sort of springtime, it is a very long fast. So they fast in the winter as well, and find that much easier and have no problems with their diabetes fasting during winter months. Perhaps consider fasting, maybe some practice fasts right during this month, during the month of Shaban, if you're capable of completing it without any complications. And the sort of people that we're talking about high risk, well, certainly people with type 1 diabetes. So those of you that may have diabetes that that needs insulin for existence. So many people with type 2 have need insulin as well. But type 1 diabetes, where you have to have insulin with no other treatments available, then actually that's quite a high risk for fasting, and sometimes can be very difficult, and people can be exempt from fasting. If you use 2 or more insulin injections a day, then that's another reason for considering that you're at high risk, and you could find other alternatives. If your diabetes is poorly controlled, or if you have often very low blood glucose levels, particularly if you don't have symptoms. So there are some people, as you know, who have hypoglycemia unawareness, who don't have symptoms of low blood glucoses, who should not be fasting, because that's a significant danger. If you have significant problems with your kidneys, your liver, your heart, these are also very high risk for fasting. Of relevance right now, if you've had recent COVID-19, or you have ongoing, if you have COVID-19 right now, or you have a diabetic foot infection or other infections, that's an acute problem. As Imam Sahib has said, you can forego fasting for those days, fully recover, and then consider doing your fast at a later date. If you've been in hospital with a high or low blood sugar in the last 6 months, and if you are pregnant or breastfeeding, and also actually if you have very, very good control of your diabetes on treatment that might give you low blood sugar, such as gliclazide, which is a tablet for diabetes, or insulin. If you have very well controlled diabetes, then having prolonged fasting can be quite difficult as well. So you might be quite high risk in that sort of circumstance as well. So what are the safety tips that we advise? Well, we always advise carrying glucose treatment with you. So just in case you were to go hypo, you must be breaking your fast and carrying glucose treatment with you. If you're on insulin or gliclazide, the sulfonylurea type drug, then you should be thinking about monitoring your glucose levels on a regular basis. And especially if you're feeling unwell, and you must stop your fast if your glucose falls below 5. Or it goes above 17. Those are the sort of recommendations that the guidance is suggesting at the moment. If you go above 17 or below 5, you should be stopping your fast and breaking and doing something about those levels. And if you become severely dehydrated, such that you can't even sort of get up, you should be ending the fast immediately. Very, very important point. You shouldn't be stopping your tablets or insulin. So please don't stop them completely. You must speak to your doctor or your nurse and think about changing the dose or changing the timing of your injections or your tablets. That's a very important point. And that's why you should be planning your fast well before the start of Ramadan. These are sort of foods that we probably shouldn't be eating. So you can see here huge amounts of biryani and burgers and chips and cakes and so on. Look, Ramadan is a wonderful time. Unfortunately, of course, it's not as family time as it used to be. We used to all go to each other's houses and break our fasts and so on with lovely, tasty meals, samosas. And who can have one samosa? It's difficult to just have the one. But the issue with this is that actually, of course, if we have these sorts of foods at the break of fast, then this will lead to often very high levels of glucose, and that can also be a burden on your health as well. So please be careful with that. This is the typical sahur. The sahur is the meal that we have just before the start of fast. This is what many people have. They might have a couple of pieces of toast, some Rice Krispies, some juice, these sort of things. But of course, if you look at this contains actually quite a lot of carbohydrate. This contains 100 grams of carbohydrate. All of that carbohydrate will break down into sugar. It could lead to quite a high level of glucose. And a lot of this glucose is very short acting, so it's not a high, it's not going to stay there for long, but it can lead to a very high level of glucose and make you feel quite poorly, quite dehydrated. An alternative might be to maybe go for something with a bit more protein, a bit more yogurt, these sort of things, and that contains 40 grams of carbohydrate. So this is a much healthier meal. It might keep you fuller for longer and may stabilize your blood glucose levels a bit better. So thinking about what we eat at the beginning and end of fast is very, very important. So we say a healthy, balanced diet. Please, if you do decide to fast during the non-fasting hours, please make sure you drink plenty of water. Please avoid the fizzy drinks. They make you bloated. Please avoid the juices, the mango lassis, the mango drinks and these sort of things. Please avoid those and drink lots and lots of water. And preparing your meals, try and to think about grilling or oven baking. Avoid fried foods. Don't overindulge in large meals. Think about fruit and vegetables and things that will stay in your system for a long time. Just a couple of words about COVID-19, because this is an important point for this Ramadan. It was the same for last Ramadan as well. So any symptoms of COVID-19, so the cough, fever, diarrhea, you might lose your sense of taste or smells, you might develop shortness of breath, please don't be fasting. It's very, very important that if you develop COVID-19, then actually dehydration can really make COVID-19 much, much worse. So a very important point is that you should be stopping your fast immediately, and you should get a test and you should self-isolate, okay? And then you can resume your fast when you're fully recovered, okay? So COVID-19, of course, might affect you very badly, but most people get it as a fairly mild illness. But inshallah, you can resume your fast when you're fully recovered or make up the fast at a later date. But please don't fast if you have symptoms or signs of COVID-19. Okay, it's a very, very important point. Just a couple of points about vaccination. Again, really, really important for us as Muslims. And I know the Sheikh and the East London Mosque have been very proactive about vaccination in the Muslim community. East London Mosque has been a wonderful vaccine centre and so on. Can Muslims take COVID vaccines in Ramadan? Please go and have your COVID vaccine. Even if you're fasting, the British Islamic Medical Association have put out this poster saying very clearly that the taking of an injection, an intramuscular injection, does not invalidate your fast. So you can have an injection during fasting. You may obviously get some people get some pain, some fevers, some sickness and so on. So you may have to not fast the next day, but you can take your injection of vaccine. So if you're offered your injection, please go, don't cancel it, go and have your injection. It's so important to reduce your risk of COVID-19. Many of you might be asking about tests. So the lateral flow test, many of your children might be having these tests done at school at the moment. PCR tests, these are valid. They don't break your fast. So please be clear that they don't break your fast. You can do these without a problem during the fast of Ramadan. And one other thing actually that some people do have some confusion about is testing blood. The finger prick test for glucose for people with diabetes does not break your fast. Again, a very, very important point that you can test your blood without invalidating your fast. It's a perfectly valid thing to do. So my take-home messages before we open up to questions are: talk to your doctor or nurse or diabetes team about fasting before Ramadan if possible. Now is the time to do it. Book a telephone consultation or an online consultation. Have a talk with your team about whether you should fast or not. If they say don't, then please listen to them. There is a reason why they are trying to do their best for you. If they're concerned about your risk of fasting, then please discuss that with them. You might need, if you decide to fast and you agree it's safe to fast, then you might need some adjustment in your medication. So again, your healthcare team will help you with that. You can test your blood glucose. It doesn't break your fast. Look for signs of a high glucose, a low glucose, or dehydration. Carry glucose tablets in case of a hypo. And if you're ill, particularly any signs of COVID-19, please break your fast and get your COVID-19 vaccine. So important, please, to get it done as soon as you're invited. So I pray for your health and success over this Ramadan. Please pray for mine. Inshallah, we'll all be successful. Thank you for your attention and have a blessed Ramadan. I'm very open to answering questions.
Thank you very much, Professor Chowdhury, and thank you also, Sheikh Mohammed, for your fantastic talks. I think everyone would agree they're very informative and useful and timely as well. And now we'd just like to as Professor Chowdhury said, open up for the question and answer. So my colleague Helen will be handling this. So if you got any questions, feel free to turn on your microphone and your camera and ask them now, or you can put them in the chat. And I think Helen might have one or two already. So I'll hand over to her for this section. Thanks.
Thank you. And I will post up links to our website, information on Ramadan and diet generally towards the end, and our public facing Facebook pages and Twitter feeds, which we will populate with help and advice, hopefully from April the 11th, 12th onwards. Could I ask Sheikh Mohammed, I've had a question. Can you pay fidya past Ramadan if you have to miss a few days for ill health or another reason? And I had a couple of questions emailed in, which I'll ask you in the same vein. The phrase that the elderly don't have to fast, is that a set age, or is it as old as people feel, as it were? And the last one, diabetes is, along with many other things, obviously a long-term health condition. Are people able to be open about the fact they've got a health condition such as diabetes, do you think, and therefore not fast? How do you moderate that kind of pressure on people to be private versus the public aspect of fasting? Thank you.
Yeah, thank you, Helen. They're all very good questions. With regards to fidya, fidya, which is fidya means ransom. So you are bound by the fast, you are bound by the obligation, you are bound by fulfilling the obligation of fasting, and you release yourself from that obligation with the ransom, which is the fidya. Now, as we said in the beginning, it may be that your illness subsides, and then you're able to observe that the like number of days which you missed after the month of Ramadan. As Professor Chowdhury mentioned, some of his patients who are unable to observe the fast during the summer months and during the long days can do so during the winter when the days are shorter, and dehydration is not much of a worry for them then. But some people are incapable of fasting regardless of the weather and regardless of the length of the day. So their fidya should be paid immediately, because they know that from experience, they know that they'll be unable to fast at all. As for those who may be able to fast, then they can delay it. They can delay paying the fidya. And then if they find that they're unable to make up the days which they missed, or the entire month, if that was the case, then they can pay the fidya. They can then pay the fidya. So there is no limit. There is no limit, although it's discouraged to delay it beyond the coming Ramadan. So 11 months after you have been unable to observe the fast of, let's say, for example, 2020. To leave it until the Ramadan, which is coming in about a month's time, of 2021. So there's no limit, but it's disliked to delay it beyond the year. In terms of age, being old is being old and reaching a senior and mature age in of itself is not an extenuating circumstance that would grant you the license and the concession of not fasting. It goes back to your health. It goes back to your health. If your health permits for you to fast, then you must do so. If your health doesn't permit, then you need not fast. And as we said, that can be a short-term health condition or long-term health condition. So with age, there come age-related conditions, which the reality.
I think we've had a slight technical issue there. Hopefully it's just a momentary blip.
Do you want me to pick up things, Anthony? Here we go.
Hello.
Sorry, Sheikh Mahmoud, we lost you there for a moment. You just cut off there about.
What was the last thing I said that you heard me say?
It was to do with Imam Sahib. It was to do with being elderly and whether that exempts you from fasting.
Yeah.
And your point was that it's not to do with the age; it's to do with the health conditions.
Yes. So with the conditions that are normally related to age, or even if they're not related to age, those are what prevent the person from fasting. So it's not age in of itself, nor is breastfeeding, nor is pregnancy. Although they are both licenses, there are details. I don't. Of course, today is about diabetes. It's not about pregnancy and breastfeeding. So age in of itself is not a reason to prevent a person from fasting. It would be the conditions that are related to age. In terms of openness about one's illness, because obviously fasting is an act of worship which is not observable. A person abstains from their food and drink and from sexual intercourse from dawn until sunset, and unless a person discloses with others that they're fasting, they don't know that. People will not know that they're fasting unless it's the month of Ramadan and it's expected that Muslims are fasting. No one would know. And eating is an overt practice that people can see. In Islam, people must not pry for reasons. One is because a person must observe a minimum level of etiquette and manners, and not embarrass the person, either because it may be a woman and that woman may be menstruating, and that is not something that in any culture a woman would disclose with men at least, and would do so, more likely do so with her fellow females, but not with men. So so one shouldn't ask, and it should be expected that might be the reason. And also because nobody is obliged to share their medical condition and their any conditions which they may suffer from, or not suffer but live with. I know that that's not it's not right to say suffer with every single medical condition, because some people live with it and manage it quite well, manage their conditions quite well, and it's not our duty to pry or to know about other people's medical conditions. So if we do see somebody eating, or we do see somebody topping up their insulin, then there's no we shouldn't ask, and you don't need to tell. You don't need to tell. And if the person asks you in a polite and friendly manner, and there is sometimes it's quite obvious whether the person is asking in a judgmental tone or just inquiring and is inquisitive, and it's at your discretion whether you wish to share with them that information or not.
Imam, can I just make a comment about that? That's it's a very good point, and many of my patients feel a sort of a social pressure to fast because they've fasted all their lives. Their family are all fasting. They feel that pressure. They feel guilty if they're not fasting. So I mean, there is a cultural thing there, right? But many of my patients whom I say, please don't fast this year, it's going to be very, very difficult, really struggle with that advice. And so, yeah, I mean, your point about this, people not prying, I think is very important. And there's a certain sort of stigma to perhaps not fasting, which I think people sometimes feel. So I would encourage people to be open about it. I mean, if your doctor has told you not to fast, then you can share that with people if that's something you feel you want to share. But yeah, I mean, it does feel like people do feel a very significant social pressure to fast.
That is true, yes. I agree.
Thank you. Could I ask you, while you're on, Professor Chowdhury, a question which is, how do people get in front of a health professional this year? We've spoken about you've spoken about 2 months, and we say on our website up to a month before if people have questions. I will put our own helpline number on, but if
it is, yeah, the helpline is very helpful actually. So if people do want to get some information from Diabetes UK, and your website is excellent as well. So definitely worthwhile. But actually, if you want some individualized advice, look, I mean, I'm in touch with GP surgeries. I was doing a meeting with GPs recently. GP surgeries are open. They may be contacting you in a different way. So it might be by a telephone, it might be by a Skype type call or whatever. There's no reason why you can't be discussing these issues over the phone. So please, if you have concerns about whether you should fast or not, or whether you need to alter your medication, you have access to your GPs and practice nurses, and they've had a lot of training and teaching from us. So if they don't know the answer, they'll come and contact us as experts, and we can help as well. But yeah, I mean, your surgeries are open, and this is a perfectly valid thing for you to be discussing with your healthcare professional.
Thank you. And in one of your slides, you spoke about hypos. Can fasting cause hypos?
So, I mean, the risk is that with such a prolonged fast, I mean, this year it's a little bit easier than previous years. I mean, over the summer we were going up to sort of 19, 20 hours, as I'm sure you're aware. And the risk of hypoglycemia during that level of fasting is very significant. As the fast gets short, so those of you that may not know, the fast gets shorter by about 10 days every year. They come forward, backwards perhaps in the year, and so they're about 10 days earlier each year. So over the sort of autumn and winter months, they become much easier. But as we have prolonged fasts, then there is a risk of your glucose going too low, particularly if you're on medication which might lower the glucose if there's not food around. So we're talking about insulin and gliclazide and these sort of drugs, which might cause a hypoglycemic attack. And hypos, are very unpleasant, but also can be very dangerous. So that's why if people are prone to them, it's going to just get worse during Ramadan. So yes, we do have people who have hypos during Ramadan, and those are the sort of people that we might say, please avoid fasting during this time, but maybe think about it during the winter where it's going to be much easier.
Thank you. Adeyinka, you have your hand up. Would you like to unmute yourself and ask the question? But just while you're doing that, I have a question for Sheikh Mohammed, which is, can you use eye drops during the fast?
Yes, you can use eye drops. What invalidates your fast is anything that gives you nutrition. Hydration is a form of nutrition, but it has to be something. So you may say, well, the chemical or the medication is within a liquid suspension. It's within it, and that would hydrate you, but it's not substantial. It's something that makes little to no difference to your body during your fast. So that's why the vaccination is allowed. All vaccinations are allowed. An asthma pump doesn't invalidate your fast either. Those are the examples off the top of my head. So there's no problem now.
Yeah, I mean, that's such an important point, Sheikh, because I had a patient a few years ago who stopped her glaucoma drops during Ramadan, saying that she thought it was invalid to take them, and she develops a severe sight impairment from it. So please take your eye drops. Asthma inhalers are valid as well. You clearly can't have things like insulin during the fasting time, so you can't give yourself an extra dose of insulin. If your glucose goes high, you have to break your fast for that occurrence. But yeah, I mean, eye drops and a medication that's not going to cause nutrition is perfectly valid to take.
Thank you. Adeyinka, do you want to unmute yourself and ask your question?
Assalamu alaikum warahmatullahi, Prof and Imam, to increase your knowledge. My question is to Professor Tahseen. In one of your, you showed that type 2 diabetes will continue to increase up to 2025 every year. Is there anything that can be done collectively as the government and individually to forestall or avert this? Diabetes UK and some other organizations, they are doing some enlightenment and programs to make people more aware about diabetes generally. Is there anything that can be done so that this forecast doesn't happen? Thank you very much.
Thank you so much, thank you so much for that excellent question. I mean, Diabetes UK do so much work on this, as you know. I suppose one of the positive things about the COVID-19 pandemic has been that the realization that things like obesity and diabetes are important risk factors for really bad outcomes with COVID. So you know, we know that people with diabetes and obesity have a much higher risk of having sort of really bad COVID. And so, you know, there is perhaps some awareness of that in government. And maybe, you know, I mean, I think this you're right that we can do things individually. We can you know, make ourselves fitter and eat better. But actually, we need to have some way of combating this obesogenic environment, this environment that makes us fatter, stops us from sort of doing exercise, and you know, eating sort of food that is cheap and unhealthy, and you know, eating healthily is much more expensive than eating unhealthily, isn't it? So no, these sort of things I think are starting to gain some traction. And hopefully, maybe we'll start to see some change. I mean, maybe, you know, we you know, that everyone's thinking that building back better is going to be, you know, doing something about particularly childhood obesity, doing something about, you know, green issues and this sort of thing as well. You know, I really hope, inshallah, that we are going to see some changes, but it has to be from government. I mean, I think that there's only certain things that Diabetes UK and you and I can do. It's going to have to be governmental action.
Thank you very much.
Thank you. Adinka, if you could mute yourself again. And Abdul, would you like to unmute yourself and ask a question?
Oh, hello. Can you hear me okay?
Yes.
Yeah. Okay, thank you. My question actually is for Diabetes UK. Regarding Ramadan and diabetes, I have type 2 diabetes myself, and I also work for Diabetes UK as a diabetes community champion in order to raise awareness. My experience tells me, with due respect to Sheikh Mohammed, that most imams in the mosques don't know what diabetes is properly, really, and people rather talk to their imams with regards to fasting than to talk to a GP. And the advice they're often given, and again, I'm only speaking from my own experience, is that no, it's okay. If Allah wills for you to live, then you will live. So you go ahead and fast. And I was just wondering if Diabetes UK have some sort of program for the imams in particular that can be put forward or referred to.
We do actually have a PDF of advice for imams, so, but it's publicly available on our website, so I can post that in the chat now, so you can see what we do say. And I suppose in many ways we are Diabetes UK, so it's our job to engage with communities, religious organisations. So I will take that back as a learning point for us to do better. We are we're really pleased with the links we do have, but and London is a big place, but we are determined to get onto every street. So just give us a tiny bit more time. We're almost at 6 o'clock. There's one question which I will read out from Gillian. It sounds slightly technical. It's about fasting, but it has technical language in, or drug names, so it might be one for either of you to answer. People prescribed SGLT2 drugs, are they okay to continue during Ramadan given the possible risk of euglycemia DKA, and should they be testing for ketones during this time? And should weekly GLPI be okay to continue during fasting? Does that make sense to
Yes,
you?
it does. Yeah. No, thank you very much, Gillian, for a very good question. So SGLT2 drugs, patients with diabetes might be familiar with them now. They're fairly new, but you might have heard of gliflozins, empagliflozin, dapagliflozin, canagliflozin. And actually, we now have some good data to suggest that they are perfectly safe. They've been used in Ramadan without any great problems. One of the things that we do say is that try to avoid starting them 1 month before Ramadan, earlier than 1 month before. The reason being that they can actually make you pass a bit more urine initially, but then they tend to settle down. So we say if you're going to start them, you either start them well before Ramadan or after. But actually, the risk of euglycemic ketoacidosis in the trials that we've been involved in is negligible. So we don't advise testing for ketones. But obviously, if people become unwell with nausea, vomiting, abdominal pain, then they should be testing their blood and probably stopping the fast anyway. And GLP-1s, these are injections that are not insulin, actually. They help with weight loss and improving glucose control, and they can be perfectly safely given during fasting, and actually might be helpful because they can reduce appetite as well. So we give them during fasting, no problem at all.
Thank you. We're almost at 6 and we don't like to keep people over the time, but if Miss Stora could unmute herself and ask a question, please, quickly. And then Joseph, possibly if we can fit you in. And I didn't know which put the hand up first, but I've gone with ladies first. So Miss Stora, if you could be brief.
Thank you very much. Assalamu alaikum, Imam and Prof. Thank you very much for this educative talk. We know that in Ramadan, the problem we usually have is the hyperglycemia because people tend to eat a lot more during that period. Unfortunately, we're in COVID, we're at home. A lot of people have added weight and the management is even more difficult. I mean, so what can we kind of stress at this time in terms of people are going to be sitting more, praying. So how do we encourage people to kind of be mindful of their exercises? When is it they do? What is it they do to kind of at least keep the mood and maybe check their food? I'm thinking about things like in terms of eating dates and in terms of use of honey, use of olive oil. These are all prophetic foods that sometimes people just feel, oh, this is healthy, but they don't know what to do. So I say, okay, 3 dates and milk to break their fast, but then they go on and eat other things. And but we are seeing that, you know, the waistline have increased, and these we have to be really mindful about. People have to be very conscious and be mindful about how they eat, what they eat. And again, I want to ask about the gut health. You know, what should they eat to kind of help, you know, with inflammation that COVID has come with it, and the new way of eating that we are faced with. You know, I'm talking about what we do
Ms.
for
Stora, can I
diabetes
just
and
get
health.
someone to answer as we are short of time?
So just
Sorry about that. I finished it then.
Yeah, no problem. I mean, you know, it's a great question, and yeah, I mean, the problem with Ramadan is it's not just fasting; it's feasting as well, and that's what people feel, and particularly at this time where we are not able to perhaps go to the mosque for our congregational prayer, not being able to do the exercise that we normally do, then that is a more of a challenge. I don't have an easy solution for you, Ms. Tura, because you know, apart from educating people and just saying, please be careful, particularly as you're saying, breaking the fast with large amounts of dates and having, you know, very sugary meals and so on. All I would say is that pointing people towards either sort of dietetic resources. So there's plenty on Diabetes UK, but also actually there's another resource which is the Diabetes and Ramadan Alliance, which if you Google that, DAR, you'll find lots of details about that, about diets, and people can get much more information about things that they can safely eat to break their fast without getting severe hyperglycemia. There's lots and lots of resources online, but Diabetes and Ramadan Alliance is the one I would point you towards. Is a very good resource.
Thank you. Joseph, are you able to unmute and ask a very brief question?
Yes. Can you hear me, please, everybody?
Yes.
Okay, thank you for the opportunity. I mean, mine is not a question. I just want to briefly say that my role is a mental practitioner working in primary care GP surgeries. I would like to say thank you to Imam and Prof for the very informative information share, because most of the clients that I see with mental health also struggle with diabetes, and they also will perform Ramadan. So this is really equipping me to be able to support the client better. So I would say thank you very much, and thank you for the time shared with us.
Thank you for that. I will hand back to Anthony just for closing remarks.
Yeah, thank you. And I think that was a good question to end on. Thanks, Joseph, because I just wanted to extend the thank you to both Sheikh Mohammed and Professor Chowdhury for this excellent session and for joining us. Apologies to everyone, we know it's run a few minutes over, so I'll be ending the recording now and we'll be finishing